what we'd like to do today. So we're going to recap on some previous engagement that we've done, particularly around the ratings and how we'll report and display those following those assessments that I mentioned before. Then I'm going to do a walkthrough of the latest prototype of a sort of an imaginary GP service and how it could look after an assessment under our new model. And then there'll be a chance to everybody will be split into breakout groups and come back, and then we'll come back to the main room and we'll look at some of the key reflections from those groups. So I think the people who are leading those groups will be taking some notes and sharing them with me, and I'll go through some of the high level points and pick out some of those for discussion rather than doing individual feedback from every group. Okay, so that's the plan for today. So a bit of background to what we're going to talk about first. Hopefully a lot of you will be aware, just over a year ago we launched a new strategy for CQC for the organisation, so we're a bit more than a year into delivering that strategy, and that strategy got four big areas: people and communities, smarter regulation, safety through learning, and accelerating improvement. And really, as you might imagine, how we publish our assessments touches on all of the areas of our strategy. Okay, so one of the big areas that I've already mentioned once already is our single assessment framework, and that has a big impact on the information that we published. So you can see in the diagram on the right hand side, you'll if you've ever used one of our inspection reports under our current model, you should be very familiar with the 5 key questions. Is it safe, effective, caring, responsive, and well led? We now have some more levels beneath that help drive a more consistent approach and a single assessment approach across different types of services, so across social care and healthcare. So below those 5 key questions, each of them, so under safety, there are different quality statements looking at things like learning culture, for example, under safety. And then there are evidence categories that we consistently capture evidence against those quality statements, and specifically then at the bottom level you've got evidence and quality indicators that might contribute, and it all gets flows up into those 5 key questions and your overall rating for a service. And that should give us a more up-to-date view. Doing more regular, maybe slightly smaller but more regular assessments under this new framework will give us a more up-to-date view of quality and help us better identify what's changing across the sectors. Why we're updating our reports at the moment. So if you're familiar with a report at the moment, you're probably familiar with a big old PDF document that gets uploaded onto a website, and you can download it from there, or you can look at it on your machine. You can print and share it away. But there's lots of reasons why we're updating them. One of the main ones is to make them more accessible to people. So as I say, at the moment, they're a big PDF document, and that causes a lot of blockers for people that you might use a PDF, that might struggle with using a PDF. So that might be because they use assistive technology, because they've got a visual or sensory impairment or physical impairment. They might use assistive technology like a screen reader or Zoom text software. They might just use Alexa or Google Assistant or any of the or Siri or any of the voice assistants. They might be using a mobile phone, and PDFs can cause problems for people on a mobile phone. So we need to make those reports more accessible to all, and addressing the PDF document is one of the big challenges for that. We want to make the information that we put on the website more up to date. So we know one of the biggest, certainly from the public's point of view, one of the biggest issues with trust and using of our information about services is how up to date it is. So the longer in the past our assessment information, then the less trust somebody has in it, which is a fairly obvious point, but it's an important one to address. And we want to help services to improve. So obviously, driving public choice and giving people good information about care services is really important, but also similarly helping providers understand how they can improve those services is a major part of this work as well. And then, making sure that we're reflecting the new model. So the work that we're doing on the single assessment framework, the new levels and the new monitoring that we're doing, we need to make sure that it's accurate and that it's effectively presented online. So there'll be some new elements, which we'll see some of these when I go through the walkthrough in a moment. But some of the new elements to the report. So we now have a summary about people's experience of the service. So if you've used one before, you're probably aware that there's a sort of general summary at the start of the PDFs at the moment. That will stay. We're using it slightly differently, the general summary, the overall summary, but there'll be a new extra summary specifically about people's experience of the service, and that's because one of the main goals of this work is to put people's experience of services at the heart of this work. And so there'll be a dedicated summary written by the inspector and checked by the assessment team, and checked by the assessment team every time they do an assessment, and that will cover what they've heard from people on the visit if they're doing an inspection itself, cover what they've heard from other public stakeholder groups. It will cover potentially what experts by experience have heard, and potentially what we've heard from Give Feedback on Care service, where people can share their experience. There'll also be some scorings for the new levels, so the quality statements like learning culture that I referred to before. There'll be numerical scoring, so yes, there'll be some numerical information as well as that rating. There'll be below that, there'll be a scoring you can see that drives that rating. There'll be comparisons to other providers, so you'll be able to see how that where that scoring sits, and whether they're at the top compared to similar services in their area or in across the country. And then you'll be able to see how things change over time, so the score or the rating, whether it's gone up or down since the last assessment. There's one of the big things, as I've been talking about, the accessibility of PDFs, is all the information will be published onto the website and usable on the website without having to open a PDF. So there'll still be an option to generate a PDF if you want to share it or to print it, but you won't have to do that in order to use the information. Everything will be available to you to just browse through. And yeah, and in order to make that work, what's different with a PDF where you're just using the scroll thing to flick through all the pages, and when you're doing it online, you obviously need to help people navigate more effectively. So we'll use menus and so on to help you get through the report. So it'll be quicker to click through than things scrolling through a very long PDF document. Okay. So just to cover some of the previous engagement we've done, these are I won't go through them all individually, but these are some of the other organisations that we've been speaking to and groups that we've been speaking to as part of the engagement work that we've been doing on this. We've also had user research sessions with members of the public and doing some with providers as well, I think, to touch on how you can use and understand these new assessments. So I'm now going to, hopefully without any technical issues, screen, and I'm going to walk through what the prototype looks like at the moment. So, so this is an imaginary main road imaginary GP practice in the town of Oxdown. So this is just a design of how a new profile page. So hopefully you'll be familiar with the profile pages on our current website, which if I click across for a second, you can see this is a real GP practice on our website at the moment in Nuneaton. So that's what that one looks like at the moment, and you have the sort of navigation menu to look at different elements. So this is what so this is a prototype of how it might look after an assessment under our new model. So on the overview page here, it's not radically different. You can see at our top level, the 5 key questions and the ratings and the overall rating are all the main elements of our publication. So two big changes to flag on the overview. One is prominent links to our 2 summary sections, so our overview, our overall summary, or our current view of the service, written and checked by the assessment team for each assessment, and then the one dedicated to people's experiences of care. And I'll show you where they're displayed in a sec. And then obviously we now have, instead of just downloading the PDF, you'll get 2 options. You'll get a download version, and you'll get a read the full version. And I'll show you what the full version might look like in a minute. So I'm just going to jump through a couple. I won't go through. There are some areas here that won't greatly be affected by this. So the registration details, map and contact details, giving feedback, getting alerts, those areas aren't really affected. So I'm mainly going to show you these 3 areas and then the online version. So the latest assessment summary page. So this is where those summaries that I've been talking about will appear. So first of all, our current view of this service. The big change, the the big thing to flag with this summary will be, as I sort of mentioned a couple of times, that the assessment team will check that each time. So even if you're having a really focused assessment on your latest assessment date that is saying, just something about one small area of effective or one small area of caring, this won't just be a summary of just that focused bit. It should be our assessment team's current view. So they'll obviously update that to put what their findings, if they found that some really poor practice and the rating has overall gone down, that will be reflected in that, but it won't just be a summary saying we looked at a tiny area of effective and it was poor. It will be an overall thing. So if the service was overall good, but they've looked at one small area and found a problem, it would still be saying that the service is overall good, but that there's this issue. And same goes for the people's experience of the service. So it will be our view or people's experience of the service across, not just on the latest assessment. So it will be updated for each assessment, but it still should be our current view of what people have been saying. Okay. So those both show here, and then there will be summaries for each of the key questions. So this is one of the things to get your head around here. So this assessment summary page is kind of an aggregated view. So it shows the ratings and our latest rating and our latest summary for each one. So these dates for each, they'll all be date stamped to show which assessment they're under, but you might get, I think on this prototype they're mostly the same, but they could be, you could have 5 key questions with 5 different dates on that if we've looked at them all under different assessments. So there's a summary here, and then how the numerical scores could work. And remember, this is just a prototype at the moment that we're testing, but there's a display showing what the scores, what the bandings will look like. So between what scores is a requires improvement, between what scores is a good, between what scores is an outstanding, and so on. And then what score this is, so where it sits. And then there's a comparison chart. So you can see this is showing how many services in the country are scoring each banding. And the idea is that we'd have this ability to toggle to compare it. So here it's saying where Main Road Medical Centre sits in comparison to other GP practices across the whole country, across England. But you could toggle that to in the local authority or pretty much any geographical area we determine to be useful. And that will be repeated for the different 5 key questions. So that's the latest summary page. And then I'm going to just pop up the top. And obviously you've got a navigation menu here, so you can jump to just the bit you're interested in. Then we've got the timeline page. So this is, whereas the other one was an aggregated view, it was showing that our latest view of each of those elements. This is instead showing a chronological view. So just literally a history of what's happened with assessments at this service, with the most recent first. So this one's showing an assessment where the overall rating is good, and you can see it's showing the scores for the 5 key questions and whether they've gone up or down as a comparison to since the previous assessment. And again, you'll have a downloader or read online the full assessment report for that assessment for the February one. And similarly, you'd get one from another date, and so you're looking at it in a date order. And the intention on that page is also in the future to bring out more updates about a service that would appear on that timeline. So at the moment it would be those assessments, but it could in the future, if you have enforcement action against a provider or location, that could appear in here. If you have major registration changes which might be of interest to people using or choosing care services, then that could also appear. So a change in a registered manager, perhaps, information like that would appear on the timeline. Okay. So they're the main 3 pages on the website, and then I'm just going to show you the report itself. So this is instead of replacing a current page on the website, this is, if you like, replacing the PDF. So in transferring it into a website version, we have a separate content menu now for the content of this report, and then you can go back to seeing the pages we've just looked at. So this contains all of the information we've just looked at, basically stuff from the 5 key questions, our overall services, but this is obviously the point in time stuff. So this is how it appeared in that report. Some of this stuff might have been updated since, So we'll have a flag. This one is the most recent assessment at the moment, but we'll have a flag at the top where it's not the most recent assessment, saying you're looking at a historic one. There might be more up-to-date information. And so similarly, you can then click, so through using the navigation menu at the side, you can get into the information we've seen, but for this specific assessment. So you'll then get so we're in safety here, we see the overview for safe, and we can then click into some of that lower level information that we're talking about. So that in this case, the quality statement of learning culture, we'll get some information for learning culture here as well. And you can navigate through, you can see you get, you can click onto the next quality statement, safe systems, pathways and transitions. Okay, so they're the main elements of the report. Some of the we have another version that we've been testing, which simplifies some of the information. So, for example, it shows performance, but without a numerical score. So, showing whether things have gone up or down, but just without the numerical score. Which is a slightly more simplified version, which we're testing with members.
Meeting, so maybe this
testing at the moment. And the other difference, so yeah, it's mainly the difference is that it doesn't have the numerical scores, and then it doesn't have the quality statement level information in a separate page. So you just have the pages for each of the 5 key questions. Okay, so I think that's all I wanted to cover in the walkthrough of the actual service. So I will stop sharing, but when we go into breakout groups, the facilitator in each of those rooms will have a link to this, so they can always put this back up on screen or reference something on it if you need to check anything. These are a lot of the same questions that we've been looking at in our user research and our other engagement sessions that we're really keen to hear from you on today.
And I think it's just time now just to kind of a quick 5 minutes for any sort of questions for clarity from you guys while we have Owen here to answer them. I think there's a few that's come through in the chat, Owen. I don't know if you...
Yeah, I was just looking at those. Yeah.
Okay, sorry.
Shall I have a quick whip through? Yeah, before we go. So I think Ed's already answered Dawn's question about the standard phrases. So yeah, exactly as Ed said in the text. Sorry, I should have gone through in more detail about some of those ones. There'll be a mix of standard statements that are automatically generated based on what assessment's been made, like what rating has been applied or what scoring has been applied, and then free text fields that the assessment team will write. So it will reduce the amount. It should have 2 impacts. It should reduce the amount of time taken to produce the report, but also increase the consistency of those reports across different services. But there will be like those summary sections, the overall and the people's experience summary will be written by. They won't be automatically generated. They'll be written by the assessment team. So Laura's question around enforcement. Yeah, so I think there were a couple of questions. I think somebody else also asked about regulatory action. So yeah, so on the prototype I've shown you, this is obviously a good rated service, which was done predominantly because that's a majority of services, and we had to, I guess you got to pick one of the levels, but yeah, it's a good challenge. We're going to make some. I had a meeting just before this one about enforcement actions and how we present some of those. So they would be, the expectation is that they'd be presented both entries on that timeline that I showed, but yeah, if there are enforcement actions, we haven't done enforcement actions brilliantly all the time, and we're now bringing more automation and better clarity of enforcement on the website. So we're slightly decoupling. In the past, there's been an issue that enforcement actions have sometimes delayed the publication of inspection report. Now your inspection report will always, or assessment report will publish, and then if enforcement needs to follow it will follow. So you shouldn't get a situation where an assessment report is sat waiting for ages for enforcement action. But they would be displayed if enforcement action is taking place. Not a completely different way to now. If you're on the overview for a service, you'd have a banner in the same way that you do now, sort of red exclamation mark kind of thing, but then also an entry on the timeline saying that we've taken enforcement action with the date and so on. Will the trust or organisation still get a draft report to FACAC? Yeah, so there's a lot of work going on the FACAC process. So I don't think the regulations governing FACAC is not changing. So so much of that process will be unchanged, although it will be it should work a lot better. So obviously the way it will work with how it's shared will be updated, and how you'll be able to feed back on it will be updated, but the actual fundamentals of the process will remain in place for providers. Simon's question: will there be a rating aggregation tool available to providers? So there's it's probably, we're obviously talking about the public website at the moment here, but there's definitely plans in place to develop what we offer providers through the portal that they'll have access to. So there should be more benchmarking information available in the future, and understanding how your assessments have got to. We're not as advanced with those plans as we are with the website side, so I don't have anything to show you on that today. But yeah, but it's safe to say there'll be a lot of improvements in that area. Dawn, your point about the monthly new reports, so I think that's around how we publish them rather than necessarily it being every month. So that would mean you'd have so the question was around whether you'd have a new report monthly. It wouldn't necessarily be a new report monthly, but the idea would be that they'd potentially be published on a monthly schedule, so you'd have a predictable time when you're, as a provider, when your report would go out, assuming you'd had an assessment that month. Any updates be based solely on data changes without inspectors crossing the threshold? Graham: yes, the intention is that not every assessment would involve inspectors crossing the threshold, and that will obviously be dictated by what we're looking at and what the methods are for that. Sorry, Brendan's question: will providers be given more guidance on quality statements? Yes, yeah. So we'll be, there'll be a lot more guidance on the website. So one of the things, first I'll deal with a couple. There's a few questions that are quite straightforward to answer. So there's a couple of comments about accessibility, some really valuable comments on accessibility. I should point out the prototype we've got at the moment. We'll be developing that further with an actual working version of a digital version, which will be tested with people who use the different forms of assistive tech that the current version can't necessarily support. That's a sort of problem with prototyping software across the board. But separately, it will then go through an accessibility audit before anything goes live. So it'll be we generally use a company called Digital Accessibility Centre in Wales, who have a range of people who actually use the assistive tech in their own lives. So they're a really great little company that generally do our audits for us. So so if you're concerned about the accessibility of what we actually build, it should all have been properly tested and then audited before it goes live. So some of the other themes there's been quite, I'm just checking whether it's public and provider. We've had quite a few comments in the groups about positivity about the graphics. People saying that the scoring graphics help is much more meaningful with the numbers, and that they generally found that helps. Some questions about how people would use the scoring, both providers and public. So from a public point of view, I think there's some questions about how the public would use the scoring, and then for providers, how clear it would be to get onto the next band, and how they would use the scorings to understand how to improve those different scorings. So I think slightly from the provider side, that might be, I mentioned earlier a bit about having those sort of benchmarking tools and information in your portal account away from the website, which hopefully will do some more engagement on the future when those plans are a bit more developed like this. Sorry, I'm just scrolling through them at the same time. There's some questions about the comparison and history of reports. So I think it would be interesting to hear a bit more. I think quite a few people have referenced how will comparison work, and how comparable are the old reports with the new. So the quick response I'll just give on that, the advantage of the new assessment framework keeping those 5 key questions and the overall rating is that fundamentally an existing report of numerically lots of a big proportion of the services, so all of care homes and GP services, will have the same high level structure. There's obviously some complexities with NHS trusts and NHS services around where they've got core services, as I think one of the group flagged. But generally, we're keeping those overall ratings the same. So there's not a sort of the same problem as if those of you who've been around long enough to remember our ticks and crosses inspections before we had ratings. When we brought the ratings in, there was a real sort of challenge to be faced of how do you publish one on top of another? How do you publish a ratings inspection on top of an assessment which resulted in ticks and crosses against 5 different things? So we don't have that same challenge. We're still using the 5 key questions. So at the top level, it shouldn't cause that many problems. At the lower level, where you've got the quality statement information and so on, that's something we're driving out. That's still to be designed at the moment. Whether you'd publish information for all the services that says, these are all the quality statements and that hasn't been assessed yet, or whether you just only gradually add that information as an assessment comes online for any particular quality statement. That's still being worked through. So yeah, was there let me just pick one of the groups so to talk a bit more about that. So Emma and Megan's group, room 2, NHS acute and mental health providers. You drew out some of the stuff on that about how the comparison work. So the different sizes compared. Were you talking there about particularly where we've got the graphs and the comparison to other providers in the same sector?
Yes, that's right. So the query was around how the comparison would work and whether or not we'd be able to toggle it out, because the example provided was other services in England, but there was a query as to whether or not that'd be able to be toggled out to ICBs and ICSs specifically. Yeah,
so the levels aren't completely agreed. I mean, the advantage of from the website end, it's a relatively straightforward change for us on what levels we put in there. The website has data for every service about which ICB it's in, which ICB area, which local authority area, which you potentially add whatever areas. I mean, generally we build this stuff for the public. So my sort of working assumption is that at the minimum it would be changing from England to the local authority area, but there's no reason why it shouldn't be ICB as well. We'll probably need to think about how we help people understand, because at the moment obviously the understanding and awareness of ICB areas is probably a little bit low, so we definitely need some explanatory stuff there. But yeah, that comparison would all be done automatically. So the assessments are all published to the website, and so the website has the data there for if you're looking at SAFE, it will know where that sits across England, and that data can be cut by ICB or a local authority area. Yeah, so there's a lot of positivity about putting people's experiences more central to the assessment reports, and then some questions or some further thoughts on people. So I think one of the groups raised about whether people's experience can also go in the overview, the main overall summary. So I guess the main overall summary, one of the big drivers is to explain that overall rating, explain our current view. So if people's experience had been a major driver of the rating or the change in the rating, there's no reason that wouldn't be referenced as well there. But I think the purpose of having that separate summary is to ensure that we are always reporting on people's experience, even where that might not be the main driver of the current rating. We will be reporting on what we've done, what we've heard with users of the service. There's lots to know, so I'm not going to cover them all now. So just to say, but we'll be using these in depth in all of our report things. So I'll just pick out a couple more things that we could potentially hear from some of the groups, if that's okay. So yeah, some more stuff around the practicality of comparing areas and services with sizes of service in particular, which is a good challenge. Yeah, I think we've definitely seen a challenge before where we've done things like automatically on the website before with like similar services nearby. Yeah, you always have to, I guess, have a rule in the site to determine what qualifies as similar. So there will be definitely some challenges with that. People saying that the summary is clear and easy to access online. That's good. One of the questions, I saw this one before. Will all the previous reports still be available for people to read online, and if so, in what format? So quick answer, everything that's available there at the moment will remain available in the same format. The expectation is that it will remain in the same format it is. So unfortunately, mainly because of technical mainly because of the technical limitations of our current services, of our current digital customer relationship management system, the system that we publish the reports through at the moment. That's all being replaced by this work. So we won't be able to completely republish everything from the past into the new system, but that everything will remain available. So if you've had 5 inspections today and the new assessment launches for your service or the service that you use tomorrow, those 5 will still. It's not like we're wiping the slate clean and just publishing a new assessment. You'll still have access to all those old PDF documents. Yeah, some people commenting it would be good to see an example of a poorly rated service. Yeah, that's a really good challenge. So I think yeah, we need to get another version. Well, the main thing that I've had on as far as just purely as prototyping and demonstrating a design is the sort of NHS Trust stuff is showing the more complex data levels of the equivalent of core services and so on. But it's a really good challenge that having a not a good one, it's having one showing enforcement action and one with potentially showing press releases or all the different types of enforcement action that we could potentially take, how that impacts on, as was mentioned earlier, how that impacts on registration information, that sort of stuff. So yeah, I can take that away and look at how we do that, and we can share that in future. Talking about what we expect of the provider as a result of what we found is definitely something we're looking at the moment. So we've got some work going on with our policy colleagues about the guidance that will be produced for our assessment teams when they're writing those assessments, and being clear about what we expect of the provider is central to that. Is facilitators, is there anything that you thought was a really hot topic in your groups that I've completely missed in scanning through these? If so, shout now.
I don't know if this has been mentioned previously. Can you hear me, Owen?
Yeah.
This is Aisha. So in our group discussion, we talked about the reports and summaries that are done, and the fact that I think you did kind of allude to this earlier on, which is that you would have these comparisons between one provider and the rest of the country. And perhaps some people might feel that that's quite a simplistic comparison where you don't take into considerations the context, the specific area that provider is in, the demand and the socioeconomic variables. So there might be something around how you provide further context. And I think one of the suggestions was looking at, how services are commissioned in a local area and using that as supplementary context to situate the provider within that.
Yeah, it's a really good challenge. I think on the mock-ups that we've got, the prototype you've been looking at, sorry, you didn't see, what we haven't added at the moment is you just got that link that you saw where it says, compared to other GP services in England. I think we definitely need some supporting content around that, to explain. So we talked about ICBs or local authorities, particularly talking about, if we're going to have those, explaining what they are, but then, as you say, talking about some of the things to bear in mind when you using that comparison information. I think that's a good idea. Okay, thanks, Aisha. So I think we're 26 minutes past. So I think Latoya's helpfully shared the slides again to prompt me, I think, to wrap things up and to cover this information about how you can stay up to date. So firstly, can I just say thank you to all of you for taking such an active part. I've got a load of notes to take away to share with all the people involved in this work and for us to use in future, which will be fantastic. It's really helpful to have this feedback. But yeah, in terms of how you can stay up to date with us, so there's lots of different ways. So many of you will hopefully already know about our digital platform where you can continue the conversation, which is our Citizen Lab account. There's a link there to it on our slides. We also have the link on our website if you need to look there. I'd also flag to you that we publish now a lot of newsletters and blogs, and you can find them on our Medium site for blogs, and you can sign up for our newsletters on our website. So they're monthly updates, either for the public or for different sectors of providers. We've got a CQC Professional Twitter account, which is in addition to our main public one. And then you can also find all of our latest podcast episodes at that link, which has got all our links on that Linktree account, I think. yeah, I would encourage you to stay in touch with the updates there and to let us know any further thoughts you've got.